What kind of doctor would you be if you wanted to be a doctor? Part 2. Cat from part 1, we have to ask, are you crazy or sane? If you're crazy, then we have to say, do you have a short attention span or a long attention span? If it's short, you need to be an ER doctor. If it's long, you need to be a psychiatrist. Next, if you're sane, we have to figure out if you're hardworking or not hardworking. If you're not hardworking, are you afraid of the light or not afraid of the light? If you're afraid of the light, you need to be a radiologist. If you're not afraid of the light, we have to ask, do you want to think big or think small? If you want to think big, you need to be a dermatologist. If you want to think small, you want to be an ophthalmologist. Now for part 2. You're sane, you're hardworking, now we have to ask, what's your attitude like? We have to ask, are you nice? It doesn't matter, or are you mean? Let's go with mean first. I did not come up with this, but if you're mean, you should go into surgery. If it really doesn't matter to you, then you have to ask yourself, is the patient dead or the patient asleep? If the patient is dead, it's pathology. If the patient's asleep, it's anesthesia. Lastly, the sane, hardworking, nice people, you have to ask, do you hate children or do you hate adults? If you hate children, internal medicine. If you hate adults, pediatrics. That's right.